cancer, or any cancer for that matter, is not infectious. It does not get transmitted from one child to another. This is a very common misconception that cancers are infectious. You cannot eat out of the same plate. Probably we should not be socializing with those children. These are the kind of common misconceptions that society has. But I would like to emphasize the fact that no cancer is transmissible. It cannot be transmitted like an infection from one person to another. And it's very important that we make these children who are affected with this disease feel accepted and not isolate them socially. Most cancers in children are not inherited. But then we have a very small percentage or a very small fraction of cancers in children which are kind of due to defective genes that the children inherit from their parents. We have a very small proportion or a very small percentage of inherited cancer predisposition syndromes in which the child basically acquires some genes from his or her parents. And these bad genes kind of predispose the child to develop a cancer. But if you have an inherited cancer predisposition syndrome, you are prone to develop quite a number of cancers. Commonest blood cancer in children is acute lymphoblastic leukemia, or in short we call it ALL. Now, ALL is one of the better cancers in children, and given the current chemotherapy protocols that we use in the treatment of acute lymphoblastic leukemia, we are looking at a cure rate of close to 90 to 95%. In some centers, we can even confidently say that the cure rate of childhood acute lymphoblastic leukemia is close to 100%. So this is again a misconception in the public that blood cancer is like a death sentence, the lifespan is shortened. Despite investing money in treatment and taking the child through the laborious process of chemotherapy and treatment. So follow-up basically serves two purposes. One is to pick up a relapse and treat it as early as possible. And the other reason for follow-up is to look for all the long-term side effects of chemotherapy, which usually impacts children the greatest. So these are the two reasons why even after completing treatment, blood cancer survivors need to be on follow-up and they need to be visiting the doctor at pre-specified intervals. The time between follow-ups can gradually be increased. Say, let's for instance, if we say in the first 1 year the child is being called every 3 months or every month. After 3 years of completing treatment, we can make that a yearly follow-up or a follow-up once in 6 months. But they need to come and visit the doctor. Tumor simply means a growth. So the ability to spread to distant sites or the ability to spread to distant organs is what distinguishes a benign tumor from a cancerous tumor. So all tumors are not cancerous. Tumors can be either benign or cancerous, and the main differentiating point is the ability of a cancer or a malignant growth to spread to different organs, which a benign growth does not. Speak about childhood acute lymphoblastic leukemia, we are talking of cure rates in excess of 95%, which is extremely good, and most of these children get cured of their disease, and it's actually a pleasure for the doctor to see the kid that they treated grow up and come back and give them a marriage card that the child is getting married. Such happy stories, such happy endings do exist in childhood blood cancer. It's not unheard of. It's something that's very common given the current chemotherapy protocols. Adults should definitely be informed of the fact that they have blood cancer. The news in children, it's kind of trickier. Obviously, in children is, a big category. We have a 3-year-old, a 2-year-old who doesn't even have the understanding of what he or she is going through. I mean, in those kids, I don't think you can even try to explain to the child that there's something wrong with the child. But when we're dealing with, like, say, a teenager, somebody who's 12 years old, somebody who's 11 years old, we do see children who are very knowledgeable, who Google these days, who are very tech savvy. In those children, I think you could still kind of hint that they have this problem and it's going to get cured. Blood cancers are generally considered to be advanced, but the good fact about blood cancers is that with chemotherapy, most blood cancers, at least childhood acute lymphoblastic leukemia, can be cured.